Just want to start off by apologizing if I sound sick, congested, snotty. It's because Florida just bursted open yesterday and apparently the pollen just is in the air and it's exploded and people are losing their minds because we're all sick as crap. So it's just me and my girl. Oh, look, I bet they missed you. They missed you sitting next to me. You just can't beat that cuteness, I guess. And I basically look like a founding father. I have not washed my hair in like 3 days and I don't feel good, so I didn't really feel like trying except for putting on eyebrows because nobody needs to see me with no eyebrows on. Like, no one. Not even me when I wake up in the morning to look in the mirror. So, sorry. For today's video, I wanted to give y'all some tips and kind of walk you through the interviewing process for dental assisting. I have had dental assisting phone interviews. I have had just where you go in and they interview. One type of interview I've never done is a working interview, and those are really big in the dental field. A lot of doctors will ask you as the assistant to come in and work with them for the day just to see how the flow is and how comfortable you seem and familiar with procedures and things like that. I've never done one of those, but I just wanted to tell you what I've learned and what I've gathered from the whole process of applying for jobs when I was in dental assisting school and then going through the interview process while I was in assisting school. So yeah, let's just go ahead and get started. Okay, so first of all, when you go to these dental assisting interviews, if you already have a dental assisting job, you probably are already going to be in scrubs and you maybe work full time and you don't have time in the middle of your day to go to an interview. So you're either going to be wearing scrubs or you're going to be wearing professional business clothes to your interview. Doctors don't mind usually if you're in scrubs because that means you're working and that means that you're already a member of the dental assisting profession and they like that. So if you have to come straight after work or maybe go on your lunch break to an interview in your scrubs, don't worry. Like, doctors don't care. As long as it's not like messy and has stains all over it, make sure you're wearing a very nice set of scrubs. Make sure you try to keep them as clean as possible. And also another thing, make sure you have like a little bit of, maybe, I don't want to tell people to wear makeup because they're like, that's so sexist. But like, honestly, like, try to look sleek, try to look super clean, put together, professional. And if that means throwing on a little mascara or something, like, just do it. Like, it can only help you. And the doctor will be like, okay, she cares about her appearance. She cares about the way she presents herself. Like, that just only shows good qualities about you to the doctor. Okay, so if you're going to go in, like, business, professional clothes, you know, khaki pants, slacks, blouse, flats, maybe some small heels. Make sure, you know, your hair isn't a frizzy, crazy mess. Make sure it's tamed. That's another thing. Doctors don't find like crazy frizzy hair to be very professional. That's just something that I've learned from my teachers and other doctors. They want it tamed. They don't want it to possibly get into the patient's face. They don't want it to get in their face. They don't want your hair to get in your eyes when you're assisting. So having tamed, pulled back, sleek, clean hair is really, really important. Same with having clean fingernails. They don't want to see you looking dirty because dental offices are very important on, obviously it's about appearance because, you know, people, the way people's teeth are a lot of the time, about their confidence, it's about appearance. And if you come in there and you look great and your teeth look great, and like that just says a lot about you, and then patients see that and they're like, oh my gosh, like their teeth look amazing, the doctor's teeth look amazing. It just adds this like value to the office and like trust in the people that work there. Things that you should bring with you to your interview. You need to bring your resume. If you have any letters of recommendations, any people that are willing to write good things about you, whether it be past bosses, past teachers, someone who's been in the field for a really long time that has worked with you, that wants to write a recommendation, bring those as well. It's really good to have. The doctor can read through them. He may not read through them, but it can only help you to have them. Okay, so during the interview process, there are definitely some questions that you need to ask because you don't want to be hired and basically be blindsided by all of these things that could have been avoided if you would just ask questions during the interview process. She is just panting away, isn't she? Okay, so some questions that I would... No, Mommy's filming. Mommy's filming. Mommy's filming. Okay, so some questions that I would personally ask and that I did ask when I interviewed for my orthodontic position is I would ask what type of procedures that they do, and this is kind of like more steered towards general dentistry because not all general dentistry doctors do the same procedures. Some are really into implants, some are really into root canals, some are really into, or some are in lower income areas, and just the reality is that they do a lot of extractions because people don't have money to save their teeth. So if you don't like extractions and you're going to work in an office where, you know, that's all the patients can afford to do, then maybe that's not something for you. So make sure when you go in there, and also certain procedures, like if they do a lot of crown and bridge and implants, that's very big money in the dental industry. So usually if they're doing those sorts of procedures, that means that they have more money to pay you and more money is coming into the office. So that's just something to keep in mind. Another thing is ask them what their core values are, what their mission statement is, because when a doctor talks about that, you can really get a gauge for what they're really after. So if they're really after just making money and just, you know, not always maybe doing the right things, but just doing things that make them money, you can kind of see that because you'll see if they're super passionate about, like, you know, I will never do anything that does not need to be done. Like, I'm here for the patients. I'm here for what's best for the patients. But if they're kind of in a roundabout way saying, like, we want these type of people here, like, we want people with money, we want to do these procedures, like, you know, you can really gauge that. And it's really important because, like, the doctor that I did clinicals with, she was at the private office. She would sometimes do procedures for free because, like, I guess, like, I don't know, me and her, we didn't quite connect in a doctor assistant way, but as a doctor with her patients, wanting to help them, like, that was so obvious to me. Like my doctor now, he obviously cares about the patient. Like, yes, money is a factor because that's how he runs his business, that's how he supports his family, but he genuinely cares about the patients and their family, and you will be able to right off the bat notice that in your doctor. Another question you should ask is, what are the duties of the assistants? So are you also going to be cleaning bathrooms, taking out the trash? Are you going to be doing sterilization? Because some offices have sterilization techs, so it's not required that you do sterilization. You know, what type of things are you know, what are your opening duties? What are closing duties? So those are important to know. That way you're not overwhelmed on your first day and you're like, I have no idea what to do. If the doctor has already told you what your responsibilities are on that first day and you're like, okay, I agree with all of this. I understand that this is what I'm doing for this amount of money and I'm okay with that. So, you know, and if on the first day those things don't align with what the doctor said, then you can confront him, you know, respectfully, of course, and be like, hey, like, this isn't exactly what you told me was going to be my responsibilities, and, you know, I don't think that the pay quite matches up with this, or if you know, want to go find a different job or something like that. I just think that's an important question to ask. Another important question to ask is, what type of technology do they have and what type of systems do they use? So what type of, like, charting systems do they use? What type of x-ray system do they use? Scheduling, what type of technology, what type of cameras do they have? What type of, like, x-ray machine do they have? So not only the system, but what type of machines do they have? Even, like, what type of ultrasonic do they have? Do they use, you know, a chemclave? Do they use a steam sterilizer? Do they use, you know, what type of equipment do they have for you to help you do your job? So, like, at my dental office, I asked, okay, we have a Pano machine, we have a Ceph machine, we have a Shofu camera for intraoral photos. We are getting a camera to take 4 impressions instead of having to take alginate impressions. So, like, if they don't have that, ask them, do they plan on getting these things? Like, are they moving into the direction of, you know, bringing more technology to make your job a little bit easier and more comfortable for the patients? So if you are replacing another assistant, another good question to ask would be, like, why did they leave? You know, what did they not do, you know, I don't get too personal about it, but just be like, you know, I understand that I'm replacing a different assistant. Was there a particular reason that she quit or was let go? How can I be a better fit for your office? Just things like that. And another thing not to ask, I wouldn't really ask, but I would just be hyper aware of the employees. I would be hyper aware of the patients. I would be just try to feel the environment. You can easily tell if assistants are not happy at their job. If you see assistants that the doctor, you're at the interview and the doctor is trying to introduce you to them and they just kind of like just ignore you, like they're not even about being polite or respectful, you don't want to work there. If they look like they're so unhappy, if they look like they're running, sprinting around the office because of maybe they're short-staffed or maybe they like just hate their jobs and they're so busy and they're spread so thin, you probably don't want to work there. You want to work for a doctor that has the right amount of people there, that treats people correctly, that gives everybody, you know, a fair amount of responsibilities to where you're not pulling your hair out, because the patients will make you do that already. You don't need that added stress. You need to do your job, do your duties, you know, work hard all day long, you know, leave like you have accomplished something and then just go home. So I hope this video helped you guys. If you have any interview questions, any interview tips, leave them down below and I will do my best to answer them. Yeah. If you also have any other video requests, leave them down below. I'm really enjoying making these videos, but I kind of want to gauge to see what y'all are wanting. A lot of people have been asking me about like school-related videos. I have filmed so many school-related videos. I filmed like a what's in my backpack, how to prepare for clinicals, 10 things I wish I knew before dental assisting school. So if you have any questions about school, those are all really good videos to watch. But yeah, I hope you enjoyed and I will see you in my next video. Bye.